What is Mingle Health's rejection rate for submissions to CMS?
Great question, George. I can't recall ever having a rejected submission to CMS. Uh, Perhaps if we look carefully enough, we'll find evidence of an early rejection that has subsequently been repaired and resubmitted. The nature of the registry reporting process includes we make our routine submissions through an API, an application program interface, that Medicare maintains and we access remotely. There's an nearly instantaneous indication of technical success when we submit to that API. Failed submissions can be repaired and resubmitted as quickly as they can be repaired. So it's often just a resubmission, sometimes a repair of something on our side, sometimes or often, more often these days, a repair on Medicare's side. We've done this long enough and often enough. Technical failures are more likely now to come from faulty code or process on Medicare's side than from our side. We have an annual lively exchange with Medicare as to help them harden their annual coding changes and upkeep. If we are not satisfied with a submission, we can resubmit, overwriting the early submission anytime up to the close of the submission window. And we take advantage of that fairly often. Sometimes just as our clients, look at your data, you think, oh, this can't be right, and find some correction that we submit. Perhaps even more often, Medicare changes their guidance documents or their rules essentially on the dime during submission season, and we often have to just search our database, search our submissions for things affected by that change, and resubmit. Often, often a fairly quick turnaround within hours or days of awareness of that issue. There's another perspective on this at which we excel. When practices come to us for help submitting, we have a better than 99% track record of building a successful submission with them. In fact, pretty much all of the examples that we don't is a choice by the practice that they've decided that the effort is just too big to and the reward too low to make it worthwhile. But there's typically always, and I'm hesitating because I'm like all the potential exceptions are flying through my head. But it really is true that it's rare that we can't build a submission with a practice interested in building it. Thanks, George. Great question.